out the Mohs sheet.
Okay, so what you're gonna need first is your patient's name. So in this case, we are prepping the Mohs sheets for Mr. Batman. So we're gonna go ahead and start with last name, which is Batman. First name, Mr. We need to get Mr. Batman's date of birth, which in this case is 01/02/1980, and I can grab that information from his chart. Okay, name, date of birth. Here we're gonna go ahead and need the path report to get the biopsy site and the diagnosis. You can also take a look at it on the mannequin. So here we can see that the location is left inferior eyelid lateral. So we're gonna go ahead and put the location. You wanna make sure you are writing it correctly. We need to be super accurate with this information. Now we need to get the diagnosis, which is gonna be basal cell carcinoma, BCC, and that we write in red. Okay, then we're gonna go ahead and check the patient's chart to see if they have any allergies. I'm gonna go ahead and go to notes and alerts, and I can see that the patient is allergic to penicillin. So I'm gonna go ahead and put here penicillin. Perfect. So that's how you fill out your Mohs surgery sheet before we get started.
As the surgery proceeds, this area gets filled in by how much anesthesia and who injected. So it's either Dr. Kormeili, Dr. Sandifar, and what we started out with. So the initial drawing would be like, let's say 5 millimeter, and then the pre-op photos, if you did that, you check that off and your initials. Once we're finally done with the Mohs, we want to know how big the final hole was. And then this is the part that would be after we decide to close it. So what kind of repair was done, and then what the final repair was done, and then who did the photo and signed it. So the way Mohs works is, say we're choosing this area and it's level 1. After the tissue is cut, we draw a map of it, and it's bisected into superior, inferior, and we decide which side is lateral and which side is medial. You don't have to do this. This is for the doctor. And that becomes level 1. Now let's say after looking under the microscope there was tumor here. Now another section will be removed from here into level 2. So level 2 would look like this. And if this was clear, it would be marked as clear and signed, and then under disposition would be like who does the closure. So it's important to know that this is level 1 and it's 2 sections, 1 and 2, whereas level 2 is only 1 section, 1 cut of the tissue. And that's important how we document the chart.